I'd like to thank you all for joining us for today's event, The Future of Primary Care.
Humana sponsored and POLITICO organized an event to take a deep dive into primary care and the changing landscape in primary care.
Humana was very excited to be able to release our 6th annual value-based care report today. Value-based care is a model where instead of reimbursing providers on a fee-for-service basis that encourages volume, we pay them for the value of the care that they provide with a focus on improving health outcomes and preventative measures.
We're seeing better quality scores for patients that are in value-based arrangements. Fewer visits to the emergency room, 14.6% lower than in traditional Medicare, 27% lower admissions to the hospital, and overall about a 20% reduction in total healthcare costs.
The value-based model provides additional resources for physicians. They keep more of the healthcare dollar than in a traditional fee-for-service model. It gives them the opportunity to spend more time with their patients, get to know some of the other things that may be going on with those patients, and really help improve their health.
Value-based care has produced a laboratory of true care transformation. We're talking about somewhere between $750 and $1 trillion a year that's being wasted in healthcare. There are proven interventions that, if scaled, could reduce that waste by approximately 50%.
We've seen incredible progress over the last 5 years with respect to decreasing complexity required of our physicians to report on quality measures. We've also seen a movement from check-the-box quality measurement more towards quality measures that really matter, that incentivize outcomes and patient health, like blood pressure control, diabetes control, hospitalizations, readmissions, and emergency room utilization.
The context of a person's life has a huge impact on their health. If they're socially isolated, if they have housing instability, food instability, difficulties with transportation, these factors all are highly correlated with the patient's health outcomes and their healthcare costs.
Hopefully we're encouraging more physicians to get engaged in those conversations around social determinants and other barriers to patients actually carrying out a healthcare delivery plan.
It's more important than ever to have involvement with our community centers, expand the team for primary care, including pharmacists, social workers, dietitians, who all need to work together to manage patients with chronic care.
That's where a real partnership with a health plan, a real partnership in a value-based arrangement with a payer can help fill in the gaps.
If we can leverage the physician relationship to help bring access, we can create more capacity in that patient's life so that they will actually carry out the healthcare behavior you want them to, get healthier, and keep them out of the hospital. And then it becomes this virtuous cycle that there's more dollars in the healthcare delivery system because we're not spending it all on acute care that we can put back into program services, better integration, better data aggregation for the membership.
You need to change that confrontational relationship between a payer and provider to one that's more aligned. A health plan may create administrative barriers like prior authorization for a provider to reduce the waste of too much of a specific type of procedure. The provider experiences just more administrative complexity, time spent that does not provide value for a patient.
Sometimes there's a conflict between certain portions of the healthcare delivery system that are volume-based and still are moving toward increasing volume, which would increase costs, and others that want to work in a value-based setting, which does not emphasize volume.
It is really important because it builds this important foundation to manage and work with patients to improve their health, and that is critical, that partnership.
We're going to be looking to primary care docs to say, how can we do better? Because the more we roll up our sleeves together, the more we figure out how to partner together to really solve this problem of delivering the best care, the most integrated care, the most effective care, the most coordinated care for our members, and reduce as much waste as possible. That is how we're going to solve some of the biggest problems we have in healthcare today.